what we're going to be going through now is a short case. So this is a sample of what you may get when you're sort of in reading time, just on the front before you get into the room. You know, what you can see there is that it instructs you, this is an 8-minute station, read the following case. This consultation takes place in a single session. Now, what we've got here is some additional instructions in regards to the actual station itself. It's sort of mentioning that you need to take a history and, when required, to ask for the appropriate physical examination from the examiner. And following that, you want to show, you want to sort of express what your diagnostic impressions are, and essentially go through your management. Now, this is the case itself that we're going to start with. So you'll see on the case, Rowan's coming to see you in regards to the annoying cough, which is probably not that uncommon of a presenting complaint. You'll get this sort of information provided to you as part of the STEM before you go in. So this is all still during reading time, and you can see there his sort of personal details and some of his social history and other important aspects. Now, this information that you see here is information in regards to the case in a bit more detail. This is the information that will not be available to you, and this is what you must try and cover during the history. So you can see there that it goes through, you know, that Rowan has been an asthmatic since he was quite young. He's been hospitalized before for this and has required admissions to short stay most recently about 8 years ago. He's unsure about immunizations, and but roughly remembers that you know, he's had everything going through school. You can also see that he mentions that he's a smoker. What will be, and I'll sort of let the audience read through the rest of that case, but essentially this is some of the things that will be very important for you to cover during the station, and they're not things that you will be provided during the case. This is actually sort of, I suppose, what the role player will get. Now, what instructions there will be for the role player as well as the examiner will be to sort of go through you know, these points. You know, there will be aspects of things where the patient will very readily provide to you, and then there'll be things that you see in the second part there where you really have to ask specifically regarding it or cover it in a bit more detail. And this is just you know, the rest of the case for the examiner as well. Some of the other things that you know, that will be prompting cues. When this case sort of tries to go through a similar template to what you see in Susan Wern's OSCE book, if you've been practicing through that book. Now, this is the rest of some of the other aspects of the case to, I suppose, help you exclude some of the differentials as you're running through the case history. These will be the examination findings, and these will be provided to you during the station. Let's, you know, if we're pretending that this is an OSCE case. As you can see there, you get, you know, a BMI, his temperature, blood pressure, all his vital signs, and then sort of the main findings on examination. And here's some investigations and some basic tests that you can do in your surgery. So essentially, I suppose, just summarizing that case before, the whole point of this case was really to be able to ascertain through the history that this patient has a couple of issues that are sort of triggering off his asthma. You know, he's a smoker, he's in a workplace where, you know, there are probably fumes that are setting it off, but also, you know, he's got not particularly good compliance with his medication, and probably hasn't been reviewed for quite some time. And this will be some of the points that I suppose you're looking for to cover in management when you get to it. The diagnosis in this case is very straightforward because it sort of tells you from the outset in the stem. But the crux of this case was really to get a good asthma history and then to be able to go onto that and identify the important factors that need to be addressed.